Brian, it's a absolute pleasure to have you on the program. Thanks so much for your time to be on with us today. For those in the audience that don't know who you are, we'd love to hear a little bit about your very diverse background, and also talk about, of course, the importance of February being Black History Month as well.
Oh, great. No, thanks you, Jerry and HITLAB for bringing me on today. And just to briefly introduce myself, my name is Bryant Powell. I'm the Associate Director of Social Media Digital Platform Strategy here at Bristol-Myers Squibb. Basically, my purview is over our legacy social brands like Twitter, Facebook, Instagram, our podcasting capabilities, as well as social listening and omni-channel strategy. But it is an honor to address all of you today on the last and extra day of Black History Month. This month is not just a celebration of Black culture in the month of February. It's a dedicated time to focus on the most critical word within Black History Month, and that's story. Story is extremely important when it comes into our Black History Month, and it's really a way for us to strive and learn about those stories and allows African American stories the attention and respect they deserve. In the vast mosaic of history, this month is our chapter in the tapestry of the human condition. It's a time to reflect on the most importance of storytelling, a powerful force that transcends time and connects all of us. In the vein, I also host a podcast series called the Bold Innovators Podcast Series within my organization that is dedicated to exploring untold stories, triumphs, and challenges that shape our community, contributing to the ongoing narrative of our collective journey. Acknowledging our achievements and successes, especially in the healthcare world, is really essential. Our contributions to science and medicines have been groundbreaking, shaping the very foundations of the healthcare landscape. People like Dr. Percy Gillian, a pioneer in chemistry, broke barriers with his work in synthesizing compounds from plants. His contributions revolutionized the pharmaceutical industry, making medications more affordable as well as accessible. We also have Dr. Mary Daly, a trailblazing biochemist who achieved numerous firsts in her career. In 1947, she became the actual first African-American woman in the United States to earn a PhD in chemistry. Her groundbreaking research on the effects of cholesterol paved the way for better understanding of heart health, leaving an inevitable mark on medical science. These are just one of many important stories that are part of the world that we all live in today, creating medicines that have improved the human condition. As we reflect on the achievements of our past, let's also look forward with hope and determination for the bright future ahead. Now, everyone has a story to tell, Black, white, Hispanic, pride, and our stories are still being written. So for the month of February, and even though it's the last day of February, let's acknowledge African American stories of the past while giving pen to paper for the stories that are yet to come.
No, I love that. What a spectacular introduction to yourself, Brian, and also this particular discussion on this really important month. You're getting a lot of love in the chat, a lot of thumbs up and some hearts and stuff. So keep them coming, virtual audience. And I know we have a couple of topics to cover to the points that you made and the leaders and the pioneers in Black culture that have shaped the industry today. So we'd love to definitely dive right in and start talking about where you're currently at in the world of pharma, and talk about the inclusivity in pharmaceuticals. And we'd love to hear about your perspective on the pharmaceutical industry and how it can actively promote diversity and inclusivity, and specifically around the voices of people of color during this really special month and beyond that, of course, because we have the whole other 10 months of the year as well. So we'd love to hear about that.
Oh, definitely, Jerry. And I'm a very simple person. I always think the simple answer is always the best answer. And for me, I think the answer to that question is really providing African Americans is a platform to really tell their stories, which I was speaking to earlier, as well as the runway to speak on that perspective and really drive solutions from a number of different challenges. I can kind of bring up my own story with the creation of the Bold Innovators podcast. That podcast is a podcast which I interview leaders within our organization about their innovative mindset, what got them into their careers, and any advice they can kind of give as a corporate thought leader. That podcast came about in 2020 during obviously the crazy times of COVID, but most importantly around the murder of George Floyd. It was a very tense and very nuanced atmosphere at our organization. And we felt that we wanted to take that Juneteenth celebration to really speak to what people were speaking about, their trials and tribulations, and how we can kind of overcome. And we had many leaders speak about their background, their perspective, and it was one of the biggest events we've had ever at Bristol-Myers Squibb. And afterwards, a light kind of clicked with me. It's like, we should continue these stories and allow voices to be heard within our organization, as well as make it externally voiced as well. So with my talents in podcasting and editing and recording, I went cross matrix lead in order to reach out to our corporate affairs organization, our legal team, our IT team, to figure out how we can put or give a channel for these particular stories. After the year in 2021, we were given the opportunity to actually launch the Bold Innovators podcast. And we've been going 2 years so far. We've had 2 seasons and we're starting our 3rd season. And the great part about that is Bristol-Myers Squibb not only encouraged us and gave us a platform to succeed, it also continued to promote, give us opportunities to which now we're mentioning our social media feeds. We're at the top of bms.com, as well as we're now on Apple, Spotify, and a number of different platforms as well. So overall, that's just kind of a small example app in a major pharmaceutical corporation with 30,000 people. I'm a nobody with basically a senior manager at the time, that I was not only able to get my voice out, but get the voice out of thousands of Black employees to really be thought leaders within the pharmaceutical industry.
That's amazing. No, that's absolutely terrific. It really is important to be able to, within this industry, to be able to give that voice, to the people that are really helping to shape the direction that the industry is moving in. On that, to stick with the, I suppose, theme of leadership and mentorship around bringing Black voices to the forefront and to be able to make them heard within the industry. I'd love you to talk about how pharmaceutical organizations are fostering or can foster leadership opportunities, and also any mentorship programs that are out there to be able to support the professional growth of these individuals from these different backgrounds within the industry.
Oh, definitely, Jerry. And kind of what I said earlier, I'm a very simple, straightforward person, and I have like 2 suggestions to really drive that D&I within an organization. The first is seeing yourself in the room and basically just hiring people you want represented within your organization. Uh, Again, any pharmaceutical company or any company, no matter what you do, if people don't see themselves in the room or in the building or in the industry, no matter how much money you spend, initiatives that you have, or how brilliant the strategy is, it's not going to work. We're in 2024 now. People want to see people that look like them in the room, and people aren't as inclined to be that only person, to be the martyr. No, we're in 2024 now. So that's something that organizations need to kind of lean into, as well as not only just like the entry level. We want to see individuals of color throughout the organization, from senior managers all the way to VPs, because within that, we can see that not only can I start my career at an organization, I can see myself grow 2, 3, 5 years, 10 years from now to be a vice president. So number one advice is no, hire those you want to see represented within the organization, because we are out there, we are strong, and we provide talents to bring great things to an industry. The second part is kind of, as you said, empowering through mentorship and development, internal and externally as well. Again, at Bristol-Myers Squibb, we have a number of different platforms in which we have executive mentorship to not only African-American employees, but all underrepresented minorities within the organization, just to let them know that you have a champion for you, can give you experience and test out your particular ideas. And the most important thing, when you're not in the room, those high-level executives and mentors can be your kind of board of governors to get you over the hill when it comes to promotions and projects and additional opportunities. The second one, when it comes to, I guess, gaining skill sets and certification, is really allow us the same opportunity and, most importantly, the patience as any other colleague within the organization to take advantage of skill sets, certifications, educations to really grow our skill sets. We don't want, as African American person, I don't want anything handed to me. I want to be able to earn the things that I rightfully earned, but I want to have the opportunity, just as everyone else, to take advantage of those skill sets and those certifications and those educations. Again, it's not a handout. We want the ample opportunity for all the resources to not only develop our skill sets, but develop the organization to take them to the next venture in the path of the business. So again, simply one, really hire in the underrepresented minorities you want in the organizations, including African Americans, as well as really empower mentorship and be able to develop skill sets and allow people to earn it and give us the patience to earn it as well.
Absolutely, I totally 100% agree with you. I think you put it in a really, really clear-cut way of uh, being able to give individuals both the opportunity and the platforms to be able to make those sorts of progressions and involving all levels of leadership within that. I think you really brought up that really excellent point.
Thanks,
Um,
Jerry.
Brian, thanks so much for being on the program today and sharing, your perspectives from the farm position, and also sharing with us about your podcast. I think the team has put the link to your podcast in the chat as well as your LinkedIn. So those of you in the audience who are interested in connecting with Bryant and continuing the conversation around diversity and inclusivity within the pharma area of the industry, please do connect with him. Please do check out his podcast, and I'm sure you guys will have a lot to continue discussing. But we really appreciate your time, Brian. And we know how busy you are, especially running the podcast and amongst the other pieces that you are doing at Bristol-Myers Squibb. So we really appreciate you coming on, and we hope you come back on the program again.
Oh, will do. And again, thank you guys for giving me the platform to tell our story during Black History Month. You guys are really pushing it forward. I really appreciate it.
No, it's wonderful to have you on, Brian. Thanks so much.